This next patient came to me unhappy with the appearance of the nose. And actually one of the most common complaints that I see in my clinics is that patients say that their nose tends to droop on smiling, and this was certainly one of her concerns. In addition, she was unhappy with the appearance of the dorsal hump, but also the prominent columellar show. And what I mean by columellar show is how much of the nostrils can I see from the side. We had a long discussion. She didn't actually have any breathing difficulties. In her case, it was almost entirely aesthetic in nature. So we had a discussion about how best to manage this, and I felt that she would be an ideal candidate for dorsal preservation rhinoplasty. So this is where, instead of resecting the dorsal hump, in her case, I pushed down the nasal hump. So if we have a look here, she has a lovely smooth profile following the surgery, but instead of cutting this all away, I pushed the nose down in towards the face just by making a few little cuts to the bone using the piezotomy. In addition, I use structural grafting, and what I mean by that is using cartilage from her own septum to rebuild her nasal tip, and making sure that I've reduced this element of columellar show, and I've ever so slightly elevated her nasal tip. I think you'll see she's had a lovely 3-4 month post-operative result. She's delighted, and so am I.